That part was a difficult period. During that period, I tell you, I was having only 2 hours sleep for easily 2 weeks. And it was a mad rush. We need all the workers. That time we were having about 23,000 of them. And we got to get all of them to return to their blocks, return to their rooms, and we got to isolate them within the cluster. My team also works very hard. With the police help, we managed to do it.
I think the challenge is because of the movement of workers in the first place. Keeping track of the workers, that's where we actually work very, very closely with the dorm operator to make sure that the nominal is being updated. We also work very closely with the in-situ medical team, which is NUH, and they actually play a huge role in the medical clearance for the workers. So working hand in hand with these two partners on site helps us to ensure that no worker is being left behind, is being left out from the testing.
Once the dorm is cleared, we begin to actually schedule all workers in the dorms for 14-day routine testing so that we continue to actually keep track of the ongoing situation within the dormitories so that when we do discover a new infection, we are able to actually move in quite quickly and to actually contain the spread of the virus.
So one of the requirements for us to restart project is for us to basically work out the safety management measures plan. So all that is part of keeping our workforce safe when they restart. Like being able to have a centralized accommodation, dedicated transport, cohorting of teams on site, split of construction and non-construction, there's no mixing. On our side, we provide our workers with all the necessary PPE, sanitizer, face masks, gloves when required.
We are working with a voluntary organization that will provide the counseling service. We think that there may be more needs because we have kept these people for quite some time. Some of them may need help.
If the worker were to come forward and complain about insomnia or they show any signs of depression, the medical post will flag up to us as well. So for any of these cases that's been flagged out, we will contact HealthServe. HealthServe will provide the mental health support for them. And for extreme cases, they need we immediately send them to hospital to receive immediate mental health care.
It's definitely in the plans to actually de-densify the workers, de-densify the dormitories. It's a question of how we actually do it and when we actually do it. But at the same time, even if we don't de-densify now, we have a lot of other measures in place to actually make sure that the virus don't actually spread as what it did in the early days of the crisis.